Hey guys, today let's talk about development of venous system. Okay, this is the embryo after it folds. Okay, after it folds. So let's see the yolk sac and vital line vein. This vital line vein. What vital line vein is doing is it drains the blood from the yolk sac. The yolk sac is our future gut. So the yolk sac is the future gut. Blood from the entire gut, blood from the entire gut is collected by portal vein, right? Generally, the blood from entire gut is collected by portal vein. So the portal vein develops from this vital line vein, and there are right and left vital line veins, and the cardinal veins. There are major venous channels in the embryo. There are anterior cardinal vein. There is posterior cardinal veins, and anterior cardinal veins become superior vena cava. These become anterior cardinal vein become superior vena cava. These collect blood from the cranial part of the embryo, and posterior cardinal veins becomes inferior vena cava. These drain the caudal part of the embryo, and there is common cardinal veins are also mentioned here, and these common cardinal veins, they drain blood from the body wall of embryo, the complete body wall of embryo. And now we'll see about umbilical veins. These umbilical veins, these bring blood from mother. These brings blood from mother to the embryo. And specifically, the blood is oxygenated blood from the placenta. And there are right and left umbilical veins initially, but the right one degenerates. The right umbilical vein degenerates. Now we'll talk about the septum transversum. So the septum transversum, this structure play a role in the development of the liver and also influences the course of the veins. The vital line veins pass through it. Like for example, you can see here, generally yolk sac is our future gut. From entire gut, the blood is collected by portal vein. Therefore, portal vein is definitely developing from vital line vein. And cardinal veins collects blood from entire body wall of embryo. The anterior cardinal vein becomes superior vena cava, posterior cardinal vein become inferior vena cava. There is right and left of all these veins. And the most cranial part of embryo before folding is septum transversum. The most cranial part of embryo before folding is septum transversum. And then after folding, it is beneath the heart tubes. So it will come below the heart tube. These are heart tubes. You see, two heart tubes fused together to form this one. And here this is truncus arteriosus. This is sinus venosus. This sinus venosus part we will see. So below the heart tube there is septum transversum. This whole thing is septum transversum. This septum transversum develops into a liver in future. So I'll tell you. So in the early embryo, before folding of the embryo, before folding, the heart is in a more cranial position. That means the septum transversum is also positioned accordingly. And after folding, the heart moves to its final position in the thorax. The septum transversum contributes to the formation of diaphragm and liver. The septum transversum contributes to the formation of liver and diaphragm. And now blood from the yolk sac, that is future gut, drains via the vital line vein to the heart. Blood from the body of the embryo drains via the cardinal veins to the heart. Oxygenated blood from the placenta arrives via the umbilical veins. And we will see the transformation of these veins. And what happens here is the right umbilical vein, right vital line vein, left umbilical vein, and left vital line vein, these pass through the septum transversum. That means these pass through the liver. These pass through the liver to the right horn and left horn of sinus venosus. In the same way, anterior cardinal vein and left anterior cardinal vein, left posterior cardinal vein, left common cardinal vein are going to drain in left horn of sinus venosus, and the right anterior cardinal vein, right posterior cardinal vein, right common cardinal vein, these drain into the right horn of sinus venosus. These are the things in the overview of development of venous system. Thank you.